Hello, my name is Andrew, and today we are going to talk about a patient we just recently had and some discharge needs that he would need in order to go home. So the first one we're going to talk about is his anticipated medications and his appropriate education for them. So the anticipated medications that he will be given upon discharge would be like pain meds to help ease the pain from passing the stone. The patient should understand not to drive when taking the pain meds. Also, pain meds can disrupt the heart and breathing patterns and can cause depression. Therefore, the patient should understand to manually take the heart rates and know when to report certain conditions. Usually, the heart rate should be less than 100 less than 100 and more than 60. Another medication that the patient could be sent home on is an anti-inflammatory. Due to the recent inflammation from the stone, this would reduce the swelling. Education would be to monitor the levels of activity. Anti-inflammatory drugs such as NSAIDs can increase bleeding, therefore avoiding activity that is strenuous would be beneficial. Some recommendations for like non-pharmacological use, so non-medications, would be to use like warm compresses on the painful areas, usually the kidneys or the lower back, as this is where most of the pain is from, until that stone passes. I wouldn't recommend massaging the area as this increases the inflammation, as well as the patient experienced a bump on his lower back from previous massaging. Therefore, I would avoid this. However, the patient can try stress relieving tactics such as aromatherapy. A diet and/or fluid medication modifications he'll need. He needs to understand the importance of staying hydrated and drinking plenty of fluids, especially water. For this diet, the patient should understand to avoid salt as best as possible. The patient should understand what drinks to stay and stay away from. And then also needs to make sure they stay clear of like salty drinks, salty foods such as like tomato juice, as they're high in salt. And then also soft drinks need to be avoided at best due to the ingredients in the syrup. The activity level that the patient should understand is that being active can actually promote the passing of the stone. Therefore, try and work out as much as possible, but not right after taking the pain med. As previously mentioned, it can cause distress, and the patient stands a good chance to pass out. And however, working out or taking walks can help the process. And then what should you do with the strainer that he's given? So the strainer should be used every time the patient has to urinate, as it's the most effective way to know if the stone has been passed or not. Therefore, the strainer should be able to catch the urine in midstream. So you have to hold it midstream in order for it to catch it. It can't have like it sitting in the toilet or anything like that. You have to be able to hold it in midstream. It's the best way to know if the stone is in the past, if it's in the strainer or not. And then concerning symptoms and what to do if these develop. So some symptoms that could be concerning could be like low O2 sats due to the pain meds. If they're low, of course, you want to contact a physician. Like it should be higher than above 92%. So I'll recommend getting like a little handheld O2 reader. You can buy them at like CVS pharmacy or anything, and just monitor that periodically when taking the pain meds. The pain can also cause the patient to have increased blood pressure, increased respirations, and increased heart rate. Um, and once again, with those, it has parameters with them. So, like, if the blood pressure is really high, try taking the pain meds. And if that doesn't work, after about an hour, just relax, sit down, don't do anything strenuous, and try to just relax yourself. And if that still doesn't work, then I would contact a physician or contact the ER, depending how severe it is. Another important factor to notice for is for fever. A fever could indicate that there's an infection, and this could be life-threatening. Therefore, with all these symptoms, the patient should seek medical attention. Um, and that's about it. The patient should be able to go home. Just make sure that he has transportation for the way home due to the being on pain meds, and he'll be good to go.